Hi, everybody. I'm Dr. Steve Riggs from Living by Design Keto Nutrition here at Mercy One. And I want to cover with you a common question that I get from people on the ketogenic diet, and that has to do with what about my cholesterol? Let me share a screen with you here, go through a couple things with you about how I approach this. And this is going to be kind of a quick rundown for you, but just to kind of give us an idea. And this is specifically addressing lipids in people on a ketogenic diet, specifically, not the general population, but people that are on keto. How do I approach this? And I just want to cover a few things with you. So a lot of times I get people who come to me with like, I'm feeling great on the ketogenic diet. I'm losing weight. My diabetes is reversed. I've come off insulin. I've increased energy, and everything. Aches and pains are even better. But they're worried because their cholesterol might have gone up, or maybe they're afraid they're at higher cardiovascular risk because of that. And so how do I address these issues? Well, let me go over a couple things with you in this regard. So first of all, when you look at cholesterol, even the LDL or so-called bad cholesterol, it's a very poor predictor of cardiovascular disease. And I think this is new for a lot of people. A lot of my patients think that cholesterol is the final common pathway for heart disease. And that's really just not the case. In fact, LDL and total cholesterol turn out to be very poor predictors of cardiovascular disease. This is a slide that I got from Ivor Cummings, and it shows that of these studies, which looked at the degree of coronary atherosclerosis from coronary CT scans, comparing the LDL cholesterol level does not seem to correlate at all with the degree of atherosclerosis. So you can see for most of the studies, the LDL was not even significant or even had an inverse relationship, whereas insulin, whether you looked at insulin concentration itself or the HOMA-IR or insulin resistance factor or glucose levels, was highly significant in correlating with cardiovascular disease. This is a study from Zoe Harcombe looking at 192 different countries and their total cholesterol versus cardiovascular death rate. And you can see there's a lot of scatter here. And at best, the higher the cholesterol, if anything, it actually went down in terms of cardiovascular disease. So there's clearly not a typical correlation. You would think that if something was causing cardiovascular disease, that the higher the cholesterol level went, the greater your risk of cardiovascular disease. And actually that's not the case. So the dirty little secret in medicine is that really total cholesterol and even LDL does not correlate very well. This comes down here in this study, looking at the massive NHANES database here in the United States. The red bars are actually the LDL concentrations of people who present with heart attacks. The green bars are the LDL concentrations of people who do not have heart attacks. And you can see that actually the average population LDL is higher than those who present with heart attacks. So that obviously seems odd. And actually LDL, again, does not correlate very well. So point number one, the yellow bar at the bottom here of this slide, is that total cholesterol and LDL actually do not correlate very well with cardiovascular disease. Well, what does? Well, insulin resistance does tremendously. Cardiovascular disease increases exponentially with increasing insulin resistance. And you can see here, those with the highest amounts of insulin resistance have a much greater risk of heart disease than those with middle, and those with no insulin resistance actually have an extremely low incidence of cardiovascular disease. So point number two here is that insulin resistance correlates strongly with cardiovascular disease. So you should be very reassured that over the course of your time on the ketogenic diet, if your insulin resistance is dropping, that is dramatically decreasing your risk of cardiovascular disease, far more than lowering your cholesterol. This emphasizes another point. This graph looks at a lot of different metabolic parameters, which are important in the development of cardiovascular disease. And you can see that the ketogenic diet, which is the yellow bars here, as compared with a low-fat diet, which is the red bar, is far more beneficial. So everything going to the right on this slide is good. except for the HDL, which is up here, that you want to see go up. So you want to see that go to the left. And you can see that the low carbohydrate diet does a far better job of reducing body mass, abdominal fat, glucose levels. Of course, insulin levels plummet. Insulin resistance, which is the HOMO-IR level, plummets. Leptin levels fall dramatically because of fat mass is going down. Triglycerides, interestingly, plummet on this, and HDL goes up. So HDL truly is your good cholesterol, and that actually goes up, generally speaking, on a low carbohydrate diet. And your triglyceride over HDL ratio dramatically plummets. And that's a factor we're going to look at in a minute as well, because if you're going to look on your standard lipid panel, what's the most important number? The most important number, I would argue, is your triglyceride over HDL ratio. That does correlate strongly with cardiovascular disease, as we'll see in a minute. And as you can see from this slide, that drops dramatically on a low carbohydrate diet compared to a low fat diet. In addition, LDL particle size, which is something we're also going to touch on in a minute, is actually drops. Small LDL drops significantly, and it's small LDL, which is the bad actor here. And total saturated fatty acids in the bloodstream plummet. Interestingly, on a high-fat diet, it seems counterintuitive, but a low-carbohydrate, high-fat diet actually drops your serum fatty acids far more than a low-fat diet does. And that's because the excess carbohydrates that we're eating in America today are rapidly converted into fat in the liver and sent out into the bloodstream. That is correlated with heart disease, but primarily it's coming from excess carbohydrates we eat, not usually excessive fats. So point number 3 here is that the low-carb diet improves virtually all the metabolic parameters, and that's really important to keep in mind. This is an interesting graph that comes from the 4S trial. What is that? The 4S trial was the most powerful study showing the benefit of statin therapy with hyperlipidemia. And this was done quite a number of years ago now, and this was a subgroup analysis. And what I'm showing here is groups that were treated with statins versus those who were not. So those who were not are in the white boxes or circles. Those treated with statins were in the black boxes and circles. And the circles have a low triglyceride over HDL ratio, and the squares have a high triglyceride over HDL ratio. And what you can see here is that if you have a low triglyceride over HDL ratio, you have no benefit from statin therapy. And actually, statins don't help you at all in that setting. So that's an interesting study coming out of the most powerful study showing the benefit of statin therapy, but actually in the subgroup analysis. And these are the people that would primarily be on a ketogenic diet. As we mentioned earlier, and we saw in that previous graph, when you go on a low carbohydrate diet, your triglyceride over HDL ratio usually falls dramatically, oftentimes getting below 2. So triglycerides divided by HDL is actually less than 2. That's really beneficial, and that often happens on a low carb or ketogenic diet. And if that's you, then there's very little, if any, benefit from statin therapy, no matter what your cholesterol is. So point number 4, triglyceride over HDL ratio. It's the best lipid parameter correlating with cardiovascular disease. It's almost always improved on a low carb, high fat diet. Then if you look at the effect of carbohydrate restricted diets on LDL cholesterol levels in general, and you've carried out far enough, we find that in general, if you look at populations, there's really no significant difference in LDL at 6, 12, and 24 months. So importantly, this is looking at LDL levels beyond 6 months, because you will see LDL often goes up in the first few months on a ketogenic diet. And there's several reasons for that. One of those is that you're mobilizing fat. So when you mobilize fat from your fat stores, that fat is put into your bloodstream. It has to be carried by lipoprotein. That lipoprotein that carries that fat is LDL. So your LDL will go up as you're losing weight. So my advice to people who have started a ketogenic diet is don't check your lipid profile too soon. Wait at least 6 months or longer until your weight has plateaued or you reach your goal weight and everything's stabilized. Then you can check your lipid profile. If you do that, most often the LDL is not significantly changed. And in fact, in this large meta-analysis looking at these studies, the authors said, quote, large randomized controlled trials of at least 6 months duration with carbohydrate restriction actually appears superior in improving lipid markers when compared to low-fat diets. In fact, dietary guidelines should consider carbohydrate restriction as an alternative dietary strategy for the prevention and management of dyslipidemia for populations at cardiometabolic risk. So again, point number 5 here, most people still show no significant changes in their LDL concentration on a low-carb diet if you check it far enough out. This is a study from Drs. Finney and Volek and Hallberg, are looking at cardiovascular disease risk factor responses in type 2 diabetics with carbohydrate restriction. And again, this is the Verta Health study showing a 12% decrease in their 10-year risk for cardiovascular disease, despite, in this case, the LDL going up by 10%. So the point I'm making here is that even if your LDL does go up, the improvements in other cardiovascular disease risk factors like your increased HDL, triglyceride over HDL ratio falling, reversing diabetes, which is huge, more than compensates. And if you put that into the cardiovascular risk factor scoring equation, you'll find that for most people, this still dramatically lowers their cardiovascular disease risk, even if their LDL goes up. This slide brings me to another point, and I mentioned it earlier, in that not all LDL is bad. So some LDL is worse than others. LDL comes in different varieties, 4 different sizes, from small, dense LDLs to large, more buoyant LDL. And the slides below here show that it's the small, dense LDL, which is the bad actor. So you can see the slide on the left that patients who have high amounts of small, dense LDL, the dark line, have higher rates of cardiovascular disease than those who have low levels of small, dense LDL. Very good. Now, the large, buoyant LDL, however, doesn't seem to make a difference. In fact, if you look at that, whether you have a high amount of small, dense LDL, or large, buoyant LDL, or a small, it's all the same. Large, buoyant LDL, in other words, doesn't really contribute very much to cardiovascular disease. It's the small, dense LDL that does. Why is that important? Well, that's important because if your LDL does go up on a low-carb, high-fat diet, it's usually large, buoyant LDL. And how do I know that? Well, we can tell that when we do more sophisticated lipid testing. So that's one of the things you can do if this is a problem for you. If you happen to be one of those people where your LDL goes up significantly, we can do some fancy lipid tests which can show whether your LDL is the large, buoyant type, which is relatively benign, or whether it's the small, dense LDL, which is more concerning. So what if you're exactly that? What if your LDL does go up on a low carbohydrate diet? What can you do? Well, that's when we can do some further testing beyond your standard lipid panel. A coronary CT scan, the CAC-CT, I think would be very important if you're between the ages of like 45 and 75. We can do other lipid markers, which you can't do on your standard lipid panel. We can look at other issues like your CRP, which gives a general measure of inflammation and tracks with cardiovascular disease, and other things. Just to give you an example of this kind of testing, this is a study looking at the coronary CT. Here, this is not really a risk factor. This is actually looking at how much cardiovascular disease or atherosclerosis you have in your coronary arteries by looking at a simple CT scan. And when you do that, you get a calcium score or Agatston score. And it can go from 0, which is great, meaning you have no calcium in your coronary arteries, up to the thousands. And an Agatston score of 0, as you can see on this graph right here in the upper left quadrant, there's supposed to be 2 lines here, one treated with statin therapy and one not. And you can see that their incidence of cardiovascular disease is so low that statins make no difference. And so it doesn't matter what your cholesterol is. If you have a coronary CT of 0, you don't need a statin, and your cholesterol, frankly, doesn't matter. If you even have an Agatston score of 1 to 100, you can start to just see a little bit of separation between those treated with statins and those not. And then after 100 to 400 and then beyond 400, now you can start seeing where statin therapy might be beneficial in select cases if you tolerate them well. But this is just to point out that there's some more sophisticated testing that we can do to determine really more precisely what your cardiovascular risk is and whether the cholesterol level you have is making any difference at all. So in summary, I guess I would make these 8 points. First of all, total cholesterol and LDL, they frankly don't correlate very well with cardiovascular disease, so not sure we should worry too much about them. Number 2, insulin resistance does. And insulin resistance is the one thing I think in our country today that probably is the most important driver of all our chronic diseases, including cardiovascular disease, and virtually no one's checking it right now. So that would be number 1. I would put a lot more stock in what your insulin resistance is than what your cholesterol is. Number 3, the low carb diet improves almost all metabolic parameters. So that's just almost universal. So that's very reassuring, including number 4, your triglyceride over HDL ratio, which is the best lipid parameter on your standard lipid testing correlating with cardiovascular disease. It's almost always improved on a low carb diet. And so I would look at that. The reason for that, by the way, is triglyceride over HDL ratio itself correlates with insulin resistance. And it also correlates with whether your LDL is large and buoyant or whether it's small and dense. So the better that triglyceride over HDL ratio, preferably you like to see it less than 2, the more likely that you have lower insulin resistance. And it's more likely that the LDL you do have is large and buoyant. Number 5, even all comers, if you look at being on a low carb diet over time, they don't have any significant changes in LDL on low carb, high fat. They often improve, in fact. But even number 6, if your LDL does go up, the improvements in your other cardiovascular risk factors you might have had, like obesity, blood pressure, if you reverse your diabetes, if you improved your triglyceride over HDL ratio, your CRP and levels of inflammation dropped, all of these things are common on a ketogenic diet. If those things are happening, that's very reassuring. And I wouldn't let the rise in LDL derail you from that. And it usually more than compensates if you put that all into the cardiovascular risk equation. Number 7, if your LDL still goes up on LCHF, it's usually the large buoyant LDL, which is less concerning. But if you're still concerned about your lipids or you've had dramatic changes, and those do occur. So occasionally, rarely, I'll have patients who come in and their LDL just skyrockets. It'll go up in the 300 range or something like that. Then we do need to perhaps look at some other factors involved there. Sometimes people's triglycerides will go up on a low carb, high fat diet. Usually they have a defect in fatty acid metabolism or transport. So there's rare cases in which that can occur. But if that's you, then I wouldn't blow it off. I would seek medical attention from your doctor. And there's things we can do to assess that risk more precisely. But if your LDL goes up or total cholesterol goes up by 10%, 20%, or minor variations, and everything else is getting better, then in general, not too bad. So how would I answer this question? Should I be worried about my cholesterol and LCHF? Probably not, unless you're one of those rare people which have dramatic changes in their cholesterol, triglycerides, and we can look into that more precisely. So hope that gives you a little bit of a window in how to handle or think about lipids on low carb, high fat. If you have any questions, drop us a line, respond to this, and I'll be glad to answer those for you. Otherwise, keto on. We'll see you later.